Hello and welcome to Health Dialogues. I am Anshika Mishra. And as you know, Delhi's air quality has plunged to public health emergency levels once again. Toxic smog is choking the city, leading to a sharp rise in breathing problems, worsening asthma and COPD, slow recovery from viral infections, and growing risk to heart, brain, children, and the elderly. Now, to help us understand the real health dangers of this pollution crisis and what families must do right now to stay safe, we spoke with one of India's top lung specialists, Dr. Anant Mohan. Now, Dr. Anant Mohan, Professor and Head, Department of Pulmonary Medicine and Sleep Disorders, AIIMS New Delhi, has over 30 years of experience in treating severe lung disease and monitoring pollution-related health emergencies. He has led major national studies on air pollution, COPD, sleep disorder, and respiratory infection, and regularly advises government bodies on air quality health risk. In this special conversation, Dr. Mohan answered 10 most important questions on how polluted air harms the lung, heart, and immunity, and how families can protect themselves during severe smog and hazardous AQI days. Starting off with the first question, Doctor, what is the most harmful effect of polluted air on our lungs?
See, the impact is multi-pronged and it starts right from the nose. It may cause allergies, allergic rhinitis, recurrent sneezing, sore throats, cough, which may last for a long time. So these are the most common things. But if it goes below into the lungs, it may cause the inflammation and disease of the entire breathing channels. And later it may cause difficulty in breathing. So, gradually there will be more difficulty in breathing. Patient will feel short of breath. He will have to exert more. In the end stage, if it becomes too bad, then he may need oxygen, he may need medications, dilators, inhalers, bronchodilators, and puffs. So it depends. A lot of things can happen. Asthma can get aggravated. Asthma can develop. COPD can develop. So all these can happen.
Alright, doctor, moving to the next question. From which AQI level should children, the elderly, and patients stop going outdoors?
See, there is no fixed AQI, but there is the GR80 system is there, based on which, depending upon the AQI, the activities are mentioned. Right. So, I think we should follow that whatever best we can, and accordingly, wear the mask and everything, and do the activities as per the regulatory rules.
Doctor, my next question is: do N95 or N99 masks genuinely protect us from pollution-related illnesses?
I mean, they are probably the whatever best we have right now. They may be a little tight, but as far as protection goes, then probably they are more logical and feasible as compared to, not wearing anything at all.
Alright, thank you, doctor. Also, doctor, when do symptoms like breathlessness, cough, or chest heaviness indicate that someone must see a doctor?
Yeah, so if you have these kind of symptoms, then rather than do self-medication, it is better to see a doctor, because these may suddenly get aggravated, especially if a person is already diseased. Then these may get aggravated, and then it may be too late. So well in time, one should seek a doctor and medical attention rather than do self-medication.
Thank you, doctor. My next question to you is: which long-term disease can develop if someone is exposed to polluted air continuously?
So I think it can be all kinds of chronic respiratory diseases. We know dementia, neurological issues, sleep disturbances, heart attacks, even brain strokes, etc. may happen. Skin problems, eye problems. So every possible organ can get involved in the long run.
Alright, thank you so much, doctor. My next question to you is: how seriously does pollution affect people with heart disease?
So it may cause atherosclerosis, which may lead to heart attacks or other heart disturbances. And even if it leads to thickening of the vessels supplying the brain, it may lead to strokes, which is known as a brain attack. It may even lead to cancers, especially the lung cancers can definitely happen in a long term. So all these things are quite serious.
Alright, okay. Next question would be: what special precautions should asthma and COPD patients take during high smog days?
So again, they should stay indoors in a very poor air quality state. If they have any symptoms of respiratory nature, then they should seek medical attention as soon as they can, rather than neglect, because they may need to increase their medications and they may suddenly become serious. And they should always wear a mask, avoid too much of overcrowding, etc., and going out when the air quality is bad.
Thank you, doctor. And doctor, do air purifiers actually help reduce the risk of pollution-related illnesses?
See, air purifier, again, there is no clear-cut hard and fast data of actually working to prevent disease. Okay, if you are using a good quality one of a significant size that takes care of that particular room or area, and if you are sitting right there all the time, then it may give you better air for that point of time. But as soon as you start walking around and going to the atmosphere, then you are exposed to the same. So one cannot across the board say that it works or doesn't work and for whom it works. It may work for a subset for some time in a specific location.
All right, thank you, doctor. Doctor, how does polluted air weakens a child's immunity and what can parents do to protect them?
See, parents can protect them only by giving them guidance as to when, like for example, to play in the open or not to play, depending upon the air quality. Because when they play, they take in air 5 to 6 times more as compared to the other non-playing state. So that is one. Not to go out in the time where air quality is poor. If it is very poor, school and all may have. So that is the school and all may have to be closed. That is the administration decision. If possible, they should wear mask whenever they can. And of course, the general things about good nutrition, taking their medicines in time, if they have asthma or anything like that, to be extra careful. So these are the general things which can be done for the kids.
Thank you, doctor. My last question would be, what are some of the simple steps one should take to reduce the harmful effect of pollution?
Again, the same, wearing a mask whenever you go out, avoid going out if the quality is very poor, not to do over exertion, especially in the open, avoid, the early mornings and the evenings. And of course, I think as far as possible, if any new symptom comes up, take medical help as soon as possible, and then that is the only thing one can do at a personal level, nothing more.
Thank you so much, doctor. We thank Dr. Anant Mohan for sharing his invaluable insights and practical advice at a time when Delhi's residents are struggling to breathe clean air. His deep understanding of how pollution affects our health and his clear guidance on how families can stay safe serve as a reminder that protecting our lungs is not just a medical concern but a collective responsibility. Thank you so much for watching.